Welcome back to BRMC's Healthy Connections with Deb Way, registered nurse and director of...
Oh, I'm the OT.
The OT, okay. The OT, sorry, but director
right.
of the Acute Inpatient Rehab at Baxter Regional Medical Center. Welcome back. It's always such a treat to have you here, and we have your granddaughter. Help me with this, Deborah. Did I say it correctly? All right. It's such a beautiful name for a beautiful young lady. It's the same, yeah.
Yes, same as mine.
It's your namesake for Grandma. Deb, what has gone on this year? We've had so much going on at the hospital. What's been going on your unit?
We have had a wonderful year for growth. We've had, our census has been down, and we've had some issues with that. But for the most part, we've rallied. We've done well. We've been able to send our therapist off, and they're choosing to go for head injury and spinal cords and very specialized training because we're kind of trying to move forward and take our unit to the next level. So, and as we've done this, the whole time we've been working all year on getting better at dealing with certain issues. We have cruised into our 15th anniversary.
Oh, my goodness.
15 years of service to our community.
Tell all of our viewers the type of patients that are absolutely perfect for your unit.
Okay. We do spinal cord injuries, traumatic injuries. Some of them are from surgery for tumor removals, things like that. Stroke patients, Parkinson's, multiple sclerosis, traumatic brain injuries, and a lot of the cardiac patients will qualify because there's some limitations that you have to do afterwards. Medicare still holds a tight rein on who can come and how long, and I'm proud to say we've learned how to satisfy their requirements and still have about 70% of our patients go home.
Which is fantastic.
Very much so.
I've had the absolute honor and privilege of seeing the remarkable things that you do and met a number of the patients that you've served. I know that just yesterday, Elaine Alexander was kind enough to share a card with a picture, Christmas card, and a picture of one of your patients who not sure where he was at when he came to you. Maybe you could address that, but it was a picture of a father and his daughter. He was in a tuxedo walking. He had walked his daughter down the aisle.
Yes.
So, I mean, these are success stories. Do you remember the patient?
I don't really remember that one. And I saw Elaine Day and she didn't mention it, but I can tell you that I believe you're talking about a gentleman who had a brain injury and had made remarkable recovery. We had a lady not long ago come to see us who had brain tumor surgery. Several were removed, and she was like a toddler. I mean, functionally like that. She's at home doing everything she needs to do.
See, that is remarkable.
It is.
What you do up there is remarkable. I want to almost say that you take a lot of the folks that I think the rest of the medical community has given up on somewhat, or they've gone as far as they possibly can, and then you come in with all of this new technology and equipment and training that you've had your people go through. And
the thing of it is, when they're medically stable, they're not in a life and death mode then. The medical doctors and the neurologists, all these people that are just so gifted to be able to help people, get them to this level. Then when you leave the hospital part and you come to rehab, we don't focus on the symptom. We focus on the function.
Right.
So
how far can we take you?
Right. We'll address all of those other issues. 24 hours a day, we address all the medical stuff. But our focus is function. So we have a different mindset. And so when people come to us, often I welcome them to the unit and tell them, Thanks for choosing BRMC. Welcome to recovery.
Yeah.
And there we go.
And this is what, just, of course, acute inpatient, but your patients literally do check in, and they are there sometimes with you quite a length of stay.
Yeah. Some can stay up to 28 days. Sometimes you get a little bit longer. It depends on the disability and the age and if they have another issue, another comorbidity.
Yeah.
The average length of stay on our floor is 13.9 days right now.
Okay.
And we do rehab 24/7. We all work off the same treatment plan. And to me, that is what makes the unit work so well. Nursing and therapy, and Dr. Elders, who's our medical director, leads us, and we all work from the same plan of care. So if it's men assist for this one, it's men assist for this one. And nursing looks at everything therapy does. We look at what nursing does, and we try to figure out a way to make it work.
Right. Everybody's on the same page.
It is.
And it's the best thing for the patient
It is,
possible.
truly.
What have you brought with us today?
Well, we've had these for about 4 years.
Oh,
And I'm going to demonstrate
all right.
Miss Deborah.
There's
here.
our model today.
Yes.
All right, Miss Vanna, what have you got there?
This is the BioNest system for the upper extremity. And what we do is this has got a computer in it, and we build in like how much electrical stim we want you to have, how long we want you to wear it, and the electrodes inside here will stimulate the muscle. And this starts your neuromuscular re-ed. We can actually have you move your fingers like this.
Oh, my.
This will also help you with the blocks, grasp and release. The first time I ever saw this used, it was with a gentleman who was a quad, broken his neck, and he was able, with bilateral ones, to open a bottle, hold the glass, pour it, drink, and set it down.
Oh, my goodness. And as you say, function.
Really?
Something that
Yeah.
he'd not been able to do
Right,
since
right.
he was paralyzed.
Yes,
So,
you can brush your teeth in these.
oh, my.
This will allow the return to come through this programming, and then when we take this off, there's usually carryover because we've stimulated that nerve. The muscle has done what it's supposed to do. So then it will continue on.
Now, does a patient go home with this equipment?
They could. There are some cases where you would do this.
Okay.
Where
The goal
patient-
is to have them not have to use the
Right.
equipment at all.
Right.
But you're basically retraining the nerves and the brain?
Neuromuscular re-ed.
All the
Neuro,
okay.
the nerves in the muscle,
muscles.
and
Okay.
and as we do things here and it travels the pathway, then the brain remaps, gets a feeling for what we're doing, and it'll
Says,
continue
okay,
on.
this is what we need to be doing.
Right.
Yeah.
These can be purchased and you can have them at home, but for the most part, by the time you've gone through our treatment program and the outpatient program, you may
There's
not
no
need
need
this.
to.
You may not need it.
Yeah.
But now with some patients, when we talk about the lower unit, you want to get that one out? I'll set that right there.
Okay. Oh, what a good helper today.
This one fits around your leg. And what you do, you can just sit right there. She is all about being my good model today.
I'll tell you what, she is a wonderful, wonderful model. And an awful pretty one, and you look just beautiful today.
Whoops, sorry about that. Little Velcro snag. This would fit here on your leg.
Oh, I can see where the computer is. Okay, where the...
This would be around your neck.
Okay.
And this would be under your heel, and this would be clipped on the side of your shoe. So when we program this for how we want it to work for you individually, it's programmed here. When you shift your body weight, this will start the stimulation that is needed to bring your toes up and to let you do a heel-toe walk.
Wow.
And this will actually do heel-toe walking.
It's amazing. This the
And if
technology.
you stand for a minute and there's no sensation of weight shift, it'll shut down.
Okay.
And then when you're ready to go and you start moving, it fires.
Wow.
And there is a greater need to have these for individual use than there really is for the upper
For the upper.
extremity. But I've seen these used with people that have had spinal cord issues, Parkinson's. We used it on an MS patient at the hospital, and she walked up that 45-degree hill from the parking lot.
Oh my goodness.
You know, that's hard to pull, especially if you have a disability of some kind. But this actually, we've used these for about 4 years. At the time we got them, we were the second rehab unit in the state to get them, and the only one in the northern part.
In the northern part.
And we began using this, and still to this day we use these. We even have the VitaStem for the neck, so that we can actually work on swallowing.
Okay.
And you know, there's several things that people could probably give up and be okay with.
But swallowing isn't one of them.
No. Most people want to eat. You know.
We need to take a short break and leave that on so that when we come back from the break, I want to ask a few more questions about that, if that's okay. All right?
Yes.
All right, we'll be right back.